If you are currently taking medication to manage your blood pressure, the information I am about to share with you has the potential to fundamentally transform how you approach your daily routine with that prescription. There is a critical element that the vast majority of patients never fully grasp, and it goes far beyond simply which pill you are prescribed. The pivotal factor is the precise moment you choose to take it. Making a seemingly minor error in timing, a mistake that millions of individuals commit on a daily basis without a second thought, could be quietly and systematically undermining the potency of your entire treatment plan. Even worse, it could be inadvertently leaving your heart and your kidneys dangerously vulnerable during the most hazardous hours of the day. In my clinical experience, I have observed this exact same issue manifesting time and again, week after week, in patients who were genuinely convinced they were following all the rules correctly. They were eating right, monitoring their readings, and taking their pills consistently, yet they continued to battle erratic blood pressure spikes, debilitating bouts of dizziness, and unexpected health scares that could have been avoided. Today, I, Dr. Mandel, am going to meticulously dissect the most hazardous timing errors associated with blood pressure medications. These are the nuanced mistakes that rarely get a proper explanation during a rushed, 10-minute office visit, but which can profoundly influence your long-term well-being and quality of life. I urge you to stay with me until the very end, because one of these critical errors is so pervasive that most people are completely oblivious to the fact that they are making it, right up until the moment it evolves into a severe, life-altering complication. If your routine involves swallowing your blood pressure pill alongside your morning coffee, you need to pause and give this your full, undivided attention. If your daily habit includes taking your water pill anytime after 2 o'clock in the afternoon, the same urgent warning applies directly to you. And if you have ever found yourself tempted to take a double dose after realizing you missed one, then I absolutely need to have a serious conversation with you right now. What I am about to reveal is essential information that your pharmacist should have thoroughly explained to you on the very first day you brought that prescription home. We are delving into the most treacherous timing mistakes in the management of blood pressure medications. Every single day, countless thousands of patients faithfully consume their blood pressure medications, yet there remains one singular, pervasive timing error that I encounter with remarkable frequency week after week. It is a subject that most physicians simply do not have the time to properly address during a brief 10 to 15-minute consultation. If you are ingesting your blood pressure medication in the morning or at night without a firm grasp of these specific, crucial timing protocols, you could be inadvertently slashing its effectiveness by a staggering 50%. Or, in a more alarming scenario, you could be constructing a perilous window of vulnerability during which your heart and kidneys are left without adequate protection, exposing them to unnecessary risk. The advice I am sharing with you now is precisely the same comprehensive guidance I provide to my own patients after we have finalized their prescription details. It is the vital, in-depth conversation that seldom occurs within the confines of the examination room. Please, stay with me, because the third timing mistake we are about to uncover is the one that consistently shocks people the most, as it defies common intuition. I am Dr. Mandel. I established this channel with a singular purpose. The life-saving information we utilize within the walls of my clinic must not remain confined there. It deserves to be broadcast far and wide. Blood pressure medication ranks among the most frequently prescribed drug classes in the entire United States. The typical patient is given a brief instruction on what to take, but is seldom educated on the optimal time to take it, what substances to combine it with, or what to strictly avoid. This missing puzzle piece is silently and insidiously affecting the health of countless individuals far more profoundly than most people would ever imagine. Today, I am going to systematically guide you through the 5 most perilous timing mistakes associated with blood pressure medication. These are the errors that can significantly amplify cardiovascular risk, drastically diminish the efficacy of your drugs, and, in certain instances, even precipitate serious life-threatening complications. Moreover, I will equip you with the precise questions you need to pose to your doctor or pharmacist before you swallow your very next dose. If this is the kind of transparent, straightforward, and reliable medical information you are seeking, I invite you to consider subscribing to this channel. I publish one comprehensive, in-depth video every single week, laser-focused on delivering exactly this caliber of practical, real-world health guidance. Let us begin our exploration with one of the most widely prescribed families of medications, ACE inhibitors and ARBs. Drugs like lisinopril, ramipril, losartan, and valsartan are a daily staple for tens of millions of individuals. For decades, the standard boilerplate instruction has been refreshingly simple: take it once a day in the morning. However, this conventional wisdom was largely a product of medical convention and habit, rather than being backed by a robust body of compelling evidence. Recent and emerging research has begun to illuminate something quite fascinating. Patients who opt to take their blood pressure medication at bedtime may actually experience superior cardiovascular outcomes compared to those who stick with a morning routine. We are talking about a demonstrably lower risk of heart attacks, a reduced incidence of strokes, and, according to some studies, even a diminished rate of cardiovascular mortality. Why does this counterintuitive shift yield such potential benefits? The explanation lies in the body's natural, intrinsic daily rhythm of blood pressure. Your blood pressure naturally descends during sleep, only to surge dramatically in the early morning hours, a phenomenon medically termed the morning surge. This surge is the precise time when heart attacks and strokes are statistically most likely to strike. A medication that is ingested at bedtime is still actively circulating in your system and exerting its protective effect during that critical, vulnerable early morning window. Conversely, a medication taken in the morning may have already metabolized and begun to wear off by the time that surge occurs. This is not a trivial, inconsequential detail. It can carry clinically significant and meaningful consequences. However, I feel a strong obligation to be completely candid with you. The scientific landscape regarding this topic is still actively evolving. While some studies unequivocally demonstrate clear benefits associated with bedtime dosing, others show a negligible or non-existent difference. The appropriate timing is fundamentally dependent on your specific medication and the unique individual pattern of your blood pressure fluctuations. The straightforward counsel I consistently offer my patients is this: directly ask your prescribing physician, would I be a candidate for taking this medication at bedtime instead of in the morning? This single, pointed question alone has the power to unlock a far more personalized and finely tuned approach to your treatment regimen. If your doctor can articulate a clear, evidence-based rationale for why morning or bedtime is superior for your particular case, that is the ideal scenario. But if they have never even pondered the question before, that response in itself provides you with valuable insight into the depth of your consultation. Now, let's pivot to a subject that never fails to astonish people, a hidden danger that is often overlooked. I have had patients engaging in this risky practice daily, utterly oblivious to the fact that it posed a significant threat to their health. Grapefruit and grapefruit juice harbor specific compounds known as furanocoumarins. These compounds act as potent blockers of a crucial enzyme in your digestive system called CYP3A4. This enzyme is responsible for the breakdown and clearance of numerous blood pressure medications, most notably the calcium channel blockers, which include drugs like felodipine, nifedipine, and amlodipine. When this vital enzyme is neutralized or inhibited, the medication is not processed and eliminated from your body at its normal rate. The direct consequence of this blockade is that the concentration of the drug in your bloodstream can surge dramatically, sometimes escalating to perilously elevated levels. This drug accumulation can precipitate an excessive and dangerous drop in blood pressure, leading to dizziness, fainting episodes, and, in severe cases, alarming heart rhythm disturbances. What adds another layer of complexity and danger to this issue is the enduring nature of this interaction. Grapefruit has the capacity to interfere with this enzyme system for an extended period, lasting up to 24 to 72 hours after you consume it. This means the risk is not confined to the exact moment you eat the fruit or drink the juice. A glass of grapefruit juice you enjoy in the evening can still impair your body's ability to handle your medication the following morning. Therefore, if you are currently taking any calcium channel blocker, you must directly and explicitly ask your pharmacist, "Is grapefruit a concern with this specific medication I am taking?" Do not make any assumptions about its safety. Always seek confirmation from a qualified professional. We now progress to timing mistake number 3, and this particular error tends to catch people off guard more than any other, primarily because it is not about interactions with food or other drugs. It revolves around something far more mundane, yet equally critical. Diuretics, often colloquially referred to as water pills, represent one of the most frequently utilized medication classes for blood pressure management. Drugs such as hydrochlorothiazide, furosemide, and chlorthalidone function by assisting the kidneys in expelling surplus fluid from the body, thereby diminishing blood volume and subsequently lowering pressure. The timing predicament associated with diuretics is exceedingly common. A vast number of patients take their diuretic in the late afternoon, or even worse, in the evening. This sometimes happens because they inadvertently forgot their morning dose and are attempting to catch up. On other occasions, it is simply because they were never furnished with precise, explicit timing instructions at the outset. However, when a diuretic is consumed too late in the day, the outcome is both predictable and profoundly disruptive: frequent and urgent nighttime urination. Many individuals resign themselves to this as a normal, unavoidable nuisance of aging or medication, but it is anything but normal. It is a readily preventable side effect that is directly caused by incorrect timing. And here is the crucial element I need you to fully comprehend about why this issue transcends mere sleep disruption. Every single time an older adult clambers out of bed in the pitch black middle of the night, often in a state of grogginess and potentially disoriented, and with blood pressure that can shift dangerously upon standing, the probability of a fall escalates exponentially. Nighttime falls in the elderly are a leading causative factor for hip fractures. And the grim reality is that hip fractures in patients over the age of 70 carry a staggering 1-year mortality rate of 20% to 30%. That is the tangible, devastating, real-world consequence of taking your diuretic at 6 o'clock in the evening instead of 8 o'clock in the morning. The unambiguous rule I instill in every one of my patients is simple and non-negotiable. If you are on a diuretic, take it in the morning, ideally before 10 a.m., so that the peak effect of the drug occurs during your waking, active daytime hours, not in the middle of your sleep cycle. If you are prescribed a twice-daily diuretic, the second dose should never, under any circumstances, be taken later than 2 p.m. Now, let us direct our attention to another extremely common class of medications: beta blockers. Drugs like metoprolol, atenolol, carvedilol, and propranolol are extensively prescribed for blood pressure regulation and various cardiac conditions. The vast majority of patients consume them in the morning, and a substantial portion of those same individuals also habitually drink their morning coffee at the very same time or shortly thereafter. Here is the intricate physiological interplay that occurs inside your body when this combination is consumed concurrently. Caffeine is a powerful central nervous system stimulant. It activates your sympathetic nervous system, which in turn increases your heart rate and temporarily elevates your blood pressure. Beta blockers perform the opposite function. They are designed to block that sympathetic activation, slow down the heart rate, and diminish the force of cardiac contractions. Therefore, when you ingest a beta blocker simultaneously with a significant dose of caffeine, it is remarkably akin to simultaneously pressing the gas pedal and the brake pedal in a car. In the majority of individuals, the medication's effect predominates. However, in patients with certain underlying cardiac arrhythmias, this confusing and contradictory combination can directly lead to palpitations or irregular heartbeats, especially during the peak caffeine window, which typically occurs 30 to 60 minutes after consumption. There is also emerging evidence suggesting that caffeine may influence the metabolic processing of certain beta blockers, particularly metoprolol, in individuals who possess specific genetic variations affecting their drug processing enzymes. My practical recommendation is straightforward and easy to implement. If you are taking a beta blocker for blood pressure or a heart condition, make a conscious effort to wait at least 30 to 45 minutes between taking your medication and drinking your coffee. It is a minor, simple adjustment to your daily routine, but for patients with a known history of arrhythmias, this small change can be clinically meaningful and provide a significant margin of safety. This is one of the most frequent timing mistakes I observe in practice, and its impact is highly variable, depending greatly on the exact medication and the specific, unique physiological characteristics of the patient. Now let's address another highly dangerous pattern I witness all too frequently in real-world clinical practice. A patient inadvertently misses their morning dose of blood pressure medication. They later remember this oversight, perhaps at noon, at 3 p.m., or even at dinner time. The almost universal reflexive instinct is to think, I'll simply take two tonight to make up for the missed one. For a select few medications, this approach might not cause substantial harm. However, for others, especially calcium channel blockers, certain types of ARBs, and beta blockers, doubling your dose can trigger a sudden, severe, and significant plummet in blood pressure. This abrupt drop can precipitate dizziness, fainting spells, and in older adults who may have reduced vascular stability, even catastrophic falls. There is another variation of this problem that is equally concerning and prevalent. Some patients who are prescribed twice daily medications quietly and unilaterally decide to switch to once daily usage simply because it is easier to remember and fits more conveniently into their lifestyle. They often do this without informing their physician. Their casual home blood pressure readings may still appear superficially acceptable, so the reduced dosing regimen goes completely uncorrected, as the physician remains unaware of the change. However, the unvarnished truth is that their cardiovascular protection is now incomplete and suboptimal, leaving them exposed to risks they are not even aware of. The standard medically endorsed guidance for this scenario is as follows. If you miss a dose and you realize it on the same day, take it as soon as you remember. However, if you are already approaching the time for your next scheduled dose, it is prudent to skip the missed one entirely and simply resume your regular dosing schedule. Under no circumstances should you ever double up on your dose without first consulting your physician or pharmacist, because the correct and safe course of action depends entirely on the specific medication you are prescribed. Before we conclude our discussion, I want to make one point absolutely, unequivocally clear. Blood pressure medication is a life-saving intervention. The evidence firmly supporting the treatment of hypertension stands among the most robust and compelling in the entire field of cardiovascular medicine. I am most certainly not advising you to discontinue your medication. I am not implying that your doctor has made an error. What I am emphatically telling you is that the crucial conversation regarding timing, specifically when to take it, what to take it with, and the proper protocol if you miss a dose, is frequently absent from a typical, time-constrained medical appointment. And that significant informational gap can have genuine, tangible, and sometimes devastating consequences. If you are over the age of 60 and taking blood pressure medication, or if someone you deeply care about falls into this category, here are 5 crucial, empowering questions you should bring to your very next appointment. First, would it be more beneficial for me to take my medication in the morning or at bedtime? Second, are there any specific foods, supplements, or beverages I should strictly avoid around the time I take my dose? Third, what is the precise, medically appropriate action I should take if I miss a dose? Fourth, is there a particular time of day when my blood pressure tends to be at its highest? And fifth, are there any potential timing related interactions I need to be aware of with my other concurrent medications? These 5 straightforward, clearly articulated questions, when asked of your healthcare provider, can do more to enhance your cardiovascular safety than almost anything you could glean from a video, because your physician possesses the entirety of your comprehensive medical history, a context which I lack. However, my role here is to equip you with the exact questions that will catalyze and open that essential conversation. If this information has been helpful to you, if it has revealed something you never clearly heard during your previous appointments, I encourage you to share this video with someone you care about who is also navigating the challenges of managing blood pressure. And please consider subscribing to this channel, because every single week I will continue to share the kind of clinical insights that patients often never hear until it is far too late. I'm Dr. Mandel, and I look forward to seeing you in the next video.